Hello, SYNGAP Land. My name is Michael Graglia, and this is episode 150 of SYNGAP 10, the SYNGAP 1 podcast. I want to start today by thanking Dan Robert, who is our webmaster. He built a site for SYNGAP 10 on the curesyngap1.org website where you can go and click on a little mini site for each of our episodes. So instead of giving you a link to the show notes, I can just say go to syngap.fund/10 or the full link, which is in the show notes, and you can see all the episodes of SYNGAP 10. So grateful to Dan for that. The other thing I want to do is reiterate my invitation from last time. Please, if you have not signed up for the FRAZIER study, just stop what you're doing, pull over, stop, listen, whatever you're doing, just stop. Email khuba@jcu.edu. If you've got a Syngapian at home, I need you to sign up for this study. It is a very simple study. All you got to do is sign up with Katie, khuba@jcu.edu, and then stick your Syngapian in front of a screen for about 15-20 minutes, now, in 3 months, in 6 months, in 9 months. What that will do is it will give Dr. Thomas Frazier, who works with Katie, the chance to collect a lot of data on this tool he has developed and validate that tool for Syngapians. What that will do is give us a powerful and precise tool to measure improvements in Syngapians in clinical trials. We have found the experts, Dr. Frazier. We have collaborated over years and years. We have raised money. We have funded the work. Now it's up to you, families. We all need to sign up for this trial. Dr. Frazier cannot have too many people. Please sign up. khuba@jcu.edu. It is 2 p.m. here, and what's amazing is I'm vertical. So I have been up since 4:30 this morning, not because I had a Syngapian jumping on my head, although that does happen surprisingly often, but because the good people at Praxis Precision Medicine had a deep dive today. DEE in caps, P dive, and DEE stands for developmental and epileptic encephalopathies. Ingrid Sheffer says that word differently. I can't even imitate her. Anyway, they very graciously invited me to come and speak about SYNGAP 1, which is a great sign. It means that they're thinking about and working on SYNGAP 1, which indeed is true. And I, of course, agreed, and I booked a plane ticket, and I was ready to go out to Boston. I had a lot of meetings yesterday and was going to speak today. And unfortunately, over the weekend, I fell ill, and I was not in any position to get on a plane. I'm still not. But I, of course, joined virtually today, and they were kind enough to let me do that. And so I joined the meeting at 4:30 this morning, and it was just remarkable. It was Dr. Aaron Devinsky from our scientific advisory board was the MC. Marcio Souza, the CEO, spoke. Dr. Steve Petru, Dr. Ingrid Sheffer also spoke, and a number of patient advocates. I live tweeted most of it, and you can follow that Twitter thread. Links in the show notes, of course. Really good stuff, and really impressive. So clearly, SCN2A is the top of the dance card at Praxis, but what's next on the dance card are a number of ASOs through their Solidus platform, which Dr. Petru spoke about, and on that platform is a couple SCN2A, PCDH19, and SYNGAP 1. And so I spoke for SYNGAP 1, and this incredible advocate from Italy spoke for PCDH19. So the deck I presented today is, the link is in the show notes. You can go and see exactly what I said. But it was really exciting. It's exciting that the company decided to put us front and center and to talk about SYNGAP 1. That tells us that progress is being made and they're happy. And Dr. Petru put up a slide showing a number of different ASOs and sort of where they're hitting in terms of their upregulation, which means he's got a lot of ASOs that work, and he's probably identified and optimizing a couple of them. I've seen that slide before. So generally these scientists, they get their favorite slides and they talk, and whatever they're saying publicly is at least a year old. So I'm hopeful that Steve is well down the path on that one. But it was really excited to talk at that. And I know at least a couple of you were watching because I got some text messages. Thanks for that. And good job paying attention, you guys. These trials are going to hit us like a ton of bricks when they happen. It's going to be multiple trials. People are going to be trying to figure out which one to join. And the thing I want to point out about this talk today is I was sandwiched between SCN2A, which is a terrible SCN2A and 8A, which are debilitating diseases, have mortality rates. Justin West was the last person to talk. Justin West, a very powerful speaker, and that disease, KCNT1, is horrible. These kids die from this disease all too regularly. I think the mortality rate by age 10 is like 50%. And here's me like, SYNGAP's really bad. The behaviors are brutal. The psychological impacts on family is nuts. The not sleeping is horrible. The medical management is terrible. And the people in the audience are like, yeah, but your kids aren't dying. And it's really hard. It's like you can't compete with your kids might die. You can't. But there's room in the world for medicines for everybody, right? And what we have to do as the SYNGAP1 community is make clear to doctors that the unmet need for SYNGAP families is tremendous, and the burden of care is excruciating, right? And this is kind of why. And I came out of a call with another pharma company a while back, and somebody said, "Do you really think your families will submit to a intrathecal delivery," which means basically delivering the ASO medicine through an IT, intrathecal needle, which is basically a needle in the spine. And I was like, "What are you talking about?" All day long. If my kid will have less seizures, improved function, and better behavior because of more SYNGAP, give me the needle. I'll stick it in his back. And that was news to them. And I think that I shared that, I think, in an earlier podcast. And Ed, our head of communications, was like, "Oh, if they don't get that, we got to write it down." And he put out a blog this past week, Why We Need a Cure, yesterday. And it has a lot of quotes from all of you. So thank you to all of you for participating in that. You should read that. You should share it. Give it to your doctors. I really am just convinced that some of our clinicians don't really get the challenges inherent in this disease. And as these kids get bigger and more complicated, the burden of care is staggering. Which brings me to chronic grief. I spoke last week about chronic grief. Almost like the next day, there was a webinar shared by Global Genes, who's one of our strong partners, talking about Dr. Alfred Friedman. Dr. Friedman is a rare disease parent himself and a psychiatrist, and he does a lot of workshops on grief and mental health for caregivers. As I said last week, we all have a challenge to our mental health raising these children. It is what it is. So check out the link in the show notes. It's to a LinkedIn post where I reference Dr. Friedman and share that seminar. It's in October. You should consider going to it. But also, if you didn't see last week's podcast, what are you doing? These podcasts are like the most efficient way to get so much information. Now, I can't believe you haven't listened to last week's podcast. But if you haven't, just the part on chronic grief, I shared in a little SYNGAP1 short, or SYNGAP 10 short, also here. So let's talk about the conference, guys. The conference is a big deal. 72 days away. It's around the corner. I want to thank, first of all, Stacy and Lauren and the whole team and our friends at SLC 6A1 and GABA-A who are working together to make this a mega conference, right? So we're having SYNGAP 1 and we're having SLC 6A1 and we're having GABA-A in the same building, same floor. And that's going to be great for our speakers because they can go back and forth, and great for us because we can see our friends and connect with the rare disease groups, and also great on the economic side because there's some economies of scale. So it's a real case study in patient advocacy group collaboration. The agendas are up. We are actually, I think we learned this trick from STXBP1, but we have put the agendas live on the conference page, links in the show notes. Go check out the agendas. If you haven't registered, just register. If you go to one thing this year, make this it. Please book a room. Everything is in the hotel. The dinner's in the hotel. The reception's all the things are in the hotel. Stay in the hotel. Please book at the Omni. Because of that economy of scale, we got a great room rate. I think it's $185 a night. Please go. And then the other thing I want to mention, in addition to corporate sponsors, because this conference, guys, the cost of tickets does not touch the actual cost of the conference. SRF and our sponsors shoulder this every year. So this year we've invited families to sponsor. And so far, 3 families have sponsored. Suzanne Jones, our board chair, Lindsay Wazorek, our science lead, and myself have each committed $2,500 to the conference. If you are able to sponsor, if your family is fortunate enough to be able to donate $2,500 to SRF, of course you get free tickets to the conference, but really that would be huge in helping us raise the funds necessary to make this an exceptional event for everybody. So thank you to Lindsay and Suzanne for your sponsorship, and other families, please join us in sponsoring this conference. Make this annual coming together of our community something special for everybody. I want to also say in the past week, we've announced 2 very exciting grants, a grant to Dr. Lacoste in Canada. This is a grant about the vasculature of the brain, so the blood vessels in the brain. This is not something people thought a lot about. You might remember we've given also a grant to another Canadian, Dr. Bowie, on a similar topic. Dr. Lacoste, if you follow him on social media, is really interested in this topic. And I think it's an important question, right? What does a SYNGAP haploinsufficiency do to the vasculature, and how can we use the vasculature to better help our patients? This is exciting work. I will emphasize what I said in the press release. Dr. Lacoste has been a real pleasure to work with, incredibly collaborative, great communication. You might be surprised to hear this. Not all scientists are great communicators. And that is not true of Dr. Lacoste. So wonderful to to give him that grant and look forward to seeing what he does with it. We also gave a grant to Dr. Devinsky to do research on EEGs. Dr. Devinsky, you might remember, emceed this session today. We gave this grant alongside the CACNA1A Foundation, the STXBP1 Disorders Foundation, the Rett Syndrome Research Trust, KCNQ2 Cure, the Lulu Foundation. If you do not spend your life immersed in the rare disease community, let me save you some fact checking. These are some of the very best rare disease groups, period. And we are honored to be working alongside them and to be co-funding someone as exceptional as Dr. Devinsky with them. This is a big deal. This is a big deal. Dr. Devinsky doesn't need any more work to do. The fact that he said this is an issue and I want to study EEGs and how families report and how doctors report and how we can fix that is something that's informed by the number of clinical trials that he has studied and led and been a part of. And if he says something matters, it matters. And for us to be working closely with such exceptional groups is a real feather in our cap and a real testament to how SRF will do whatever it takes and work with anyone and everyone to improve the future for our kids. So that's a win. That's a win that we're in that grant, and you guys should be proud of that. And as always, when I give grants, I want to thank every donor who's raised every penny, because we are all family-raised funds. That's how we do business. Speaking of family-raised funds, our friends at UFD Tech, who have done the famous Cannonball for a Cure for the past 3 years, are currently, as I speak, doing a 6-day, 21-hour live stream from Pittsburgh. Why 621? Because the address of SYNGAP1 on the human genome is 6p2132. I think. I'm a little tired today. 6p2132. So 621 is our address, 6 chromosome, 21st, whatever, and p-arm. And so that's where SYNGAP is. So that's why Brett chose 621, and he's doing this live stream to raise funds for SYNGAP Research Fund. I think I dialed in this morning. I think he's raised like $2,000, or sorry, $15,000. Why is he not doing Cannonball for a Cure? Well, Sydney, who is one of our board members, his wife is Emmett's mom and is just an exceptional member of our community and a strong leader, is pregnant. So Brett's not leaving. So congratulations, Sydney and Brett. And thank you, Brett, for doing this live stream anyway. And if you have a chance, there's a link in the show notes to the giving page and also the YouTube live stream. He's also on Twitch. If you're a Twitcher, go check it out. It's just incredible, Brett's commitment to the fund and to making the future better for his son, Emmett. It's really exciting. Speaking of good news, I have a Friends of the Fun section of this podcast now, and I want to point out, by the way, these podcasts, you might be like, wow, Mike, these are getting really long and complicated. There's so many things. Absolutely right. Imagine how I feel. And I want to say I couldn't do it without Lauren and Ed feeding my, there's Justin West probably calling me to talk about this morning, feeding these notes so that I can, when I have time, collect my thoughts and talk to you guys. So thank you to Ed and Lauren. And yes, there's a lot going on and it's getting complicated. And that's actually more of a reason to listen to this podcast. So listen to this podcast. Ask other families if they listen to the podcast. Send this to your families. This is a powerful tool for getting people up to date on what's going on in SYNGAP land. It's never not going to be overwhelming, but the more you listen and the more you try to follow, the more things will make sense, guys. The future is coming. I've been saying this to people all day today. There's a lot of activity and opportunities coming for this community, and we're not going to be able to jump on them if we're not all read up and aware of what's going on. So here's an example. Stoke this year announced some really promising data with zeruvernesferin. It would be great if we could start giving drugs names that anybody could pronounce, guys. I can't keep up with this. I mean, I won't even tell you the names that Praxis was using today. Because these drug companies, they start with like nice little names, Prax 222. I can do Prax 222 all day long. And then it's like Ruvers or whatever stat. I have no idea what that means. Anyway, Stoke, different company, different drug, zeruvernesferin. That's sort of correct. Announced really great data from their phase 1/2 and talking about their plans to do a phase 3. So let's just talk about phase 1, 2, 3, and 4. Phase 1, I'm simplifying a little bit, but not too much. Safety. Is this drug safe? Can we stick it in humans? Very easy. Phase 2, does it a little bit of, does it do anything? Is it efficacy, right? So phase 1, safety. Phase 2, efficacy. Phase 3, can we prove it works and get approval from the FDA? So what they're talking about now is based on what they've seen in their 1/2A trial, which is like a mashup of 1 and 2. They're going to do a phase 3. And the thing I want to pull out here is that in addition to reducing there's two things I want to pull out. In addition to reducing seizures, they saw an improvement in cognition and behavior. An improvement in they were counting seizures, but they also captured the cognition and behavior go up. So when you improve the missing gene, this is in the case of SCM1A, you can rescue other functions. That should give us tremendous hope, because that is exactly the kind of thing we're looking for from Praxis and Stoke and others with their ASOs. And the other thing I want to talk about is this. They highlight this quote in their press release, but it was a good one. The 2-year natural data provided clear evidence that current anti-seizure medicines are insufficient, because even with the best available medicines, patients still suffer from continued high rates of seizures. And as these children age, their development falls further behind their neurotypical peers. Yes. Amen. Hallelujah. Amen. We need better medicines. We need these ASOs. We need Stoke and Praxis to get this work done and to keep talking to us and to keep working on SYNGAP1. And the way we do that is we let them know that we are here, that we are engaged, that we are paying attention, and that we are ready to take part in these trials. How do we do that? Well, first of all, we take part in the study. So see the first thing I said, email KHUBA, make sure that when that paper comes out from Tom Frazier, there's hundreds of SYNGAP1 patients who took part. That is a clear signal. Companies are run by scientists like numbers. A clear signal that we as a community are committed to doing whatever it takes to get drugs in our kids. And remember, we are the lucky ones because we're diagnosed. There's 1,500 patients diagnosed here on Earth. That means there's tens of thousands of undiagnosed patients. They don't have the luxury of knowing what's wrong with their kid. They don't have the ability to advocate for SYNGAP1. We do. I know it's a lot. I know we're all stressed out. I know we're all maxed out. It is what it is. We have to keep going, guys. And it works. It's working. It's making a difference. There's 297 papers on SYNGAP1 right now per PubMed. That's 2 more than the last time I talked to you. 37 of those are in this year. That's a big chunk of 297, 37. I won't even try to do the math, but it's more than 10%. Right now, that puts this year, 2024, tied for second place with 2009, which was a big year. That was the Vlaskamp year, the Andreas Jimenez paper, very good stuff. So I am certain that we are going to be over 43, which is the annual record. Anyway, there's 2 papers that came out in the past 10 days, which are pretty amazing. One of them is a case study from the Missense families. Woohoo! As you know, we worked with our friends in Finland to build a digital tool to analyze missense mutations. There's a small case study that's come out based on a few missense mutations. That'll be followed soon by a bigger paper on the Missense server and a release of the Missense server. This is incredibly exciting stuff, and I can't thank the team in Finland enough for this. So that paper came out. Also, the remarkable team at the Patrick Wild Center in Edinburgh, Scotland, put out a paper. The Edinburgh people have a lot of SYNGAP rats. Most people work with mice. The Edinburgh people work with rats. Rats are more social. They think rats are better. Other people say mice are better. It's a really interesting debate to watch for like 5 minutes, and then you just can't take it anymore. But the point is, using rats, Peter Kind, who is the Grand Poobah at Edinburgh and one of the nicest people I've ever met, has put out a paper saying this is why the gap domain is really important. Now, this flies in the face of a paper Dr. Huganier put out recently saying, hey, it looks like the gap domain doesn't matter. Now, they're not really at odds, although it would be fun to see them go at it on this one. As much as they're making 2 different observations. Dr. Huganier is saying, okay, the gap domain doesn't really seem to be a huge deal. And Peter's saying, actually, it's kind of a huge deal. So, but I think they're both holding different parts of the elephant. Anyway, it's super important, and it matters as we start double-clicking on you have a SYNGAP mutation, you don't have a SYNGAP mutation, to where is your SYNGAP mutation, and how does that affect phenotype. So these are big papers that came out this week, and I'm really excited to see them. I already talked about the SYNGAP 10 webpage. Now I get into closing thoughts. So I want to thank Zoe. Zoe has been an amazing job recruiting volunteers. If you're at all curious about how you can help with SRF, you don't have to be a scientist. You don't even have to know how to spell half the words I'm using right now. I can't. But if you can do math, if you can do project management, if you can do finance, if you can do graphics, if you can do anything, we need help. SRF is bursting at the seams, and the amount of work that is to be done and projects to be managed is exceptional. So volunteer with SRF. Go to our webpage, click volunteer. Also fundraising. There's a lot of resources on our webpage about fundraising. Check those out, singap.fund/FR for fundraising. Don't forget, we are part of the CFC. If you are a federal employee or a military employee, SRF is part of the CFC now. Our number is 33321. How handy is that? 33321, put that in the notes. Please make sure you donate through this combined federal campaign to the SYNGAP Research Fund 33321. Let's talk about fundraisers. Good job, Julie Miles. Julie's killing it. She's raised over $20,000 with her golf scramble. That's in 11 days in Greer, South Carolina. Links in the show notes. She did that great clip on TV. I'll leave that in the show notes. The gala in Jersey is in 24 days. Incredibly exciting event. Karen will be there, I hope. And we got some great speakers. Pavel, our past board chair, is speaking. Jillian McKee is speaking. Someone else is speaking. I'm sorry, I'm tired. But that's going to be an amazing event. The Missense account for the fund is at $23,000. Emmy's fundraisers at $8,000. Charmander's fundraisers at $5,000. Guys, everybody, please consider doing a fundraiser. Consider reaching out to your friends and family, your company, your boss, anyone and everyone to raise money for SYNGAP research. All of these fundraisers add up. It allows us to fund great science, to get great papers, to drive the research forward. We cannot do too much. We have so much ground to catch up on. I was sitting in this Praxis meeting today listening to the SCN 2A and 8A communities. They're so far ahead of us. And they're ahead of us because they've been identified longer and they've had a heck of a head start. But our goal and what we need to do for our kids is catch up. It's that simple. So please consider doing a fundraiser for SRF. Also, in addition to your time and your money, I'd like your blood. There is blood donation this weekend in Atlanta, Georgia. If you're in Atlanta and you haven't given blood to the biobank, please do. I was just talking to a researcher last week who's like, wait, you have like hundreds of samples of plasma in your biobank? I'm like, yeah, just apply, get the samples. So we're putting these things to good use. The COMBINEDBrain conference is also this week or next week, maybe in Kansas City. Check that out. Make sure you go there if you're anywhere near Kansas City. Another chance to give blood. And of course, if you're bringing your Syngapian to the conference, we will also be collecting samples there. Social media matters. I list all of our accounts in there. Make sure you're following and connecting with SRF on all channels. I'm especially fond of LinkedIn. I think that's where a lot of industry is. Please make sure you like and follow SRF on LinkedIn. Make sure your family does, and family and friends. And make sure you amplify our content. As always, I like to end by saying if you're newly diagnosed, welcome to the community. There's a lot of reason to be hopeful. We have resources for you. They are on our website. Please check them out. Thank you very much for listening. Thank you, Lauren, for doing all the work you're about to do to make this go out on the interwebs. And I look forward to talking to you soon.